All right, here we are with Dr. Garate. Hi, Dr. Garate.
How you doing? Nice to meet
Doing
you.
quite all right. Dr. Garate, you are a dentist in Chula Vista. Is that correct?
Yes, that's correct.
And you just, Dr. Garate, tell us a little bit. You just bought this practice, and yet you took it over from somebody else. Tell us a little bit how that all came about. Tell us maybe perhaps how and why you became a dentist, and what is your goal for this practice?
Actually, the story behind why I became a dentist is quite interesting. When I was a child, I fell down on a sidewalk, and I hit my bottom tooth. It didn't stop there. Obviously, being an active child, a playful child. Another time, running behind my brother, I was following him, and he swerved around one of those big tubes, the water tubes that are concrete. I didn't see it. I kept running, and I hit myself right on my teeth. Didn't stop there because I had one more little accident right here. But to make a long story short, both my teeth in the front were damaged. I ended up needing extensive treatment throughout my childhood as I got into my teen years. And it was quite interesting because I always became interested, in regards to teeth based on my own personal problems. I ended up getting many treatments, surgery on the different teeth. Fortunately, I was able to keep both teeth, and it's made me very conscious of different accidents, different things that can happen. So that's the reason behind why I became a dentist. I became interested in teeth at a very young age.
Well, wonderful, absolutely wonderful. The truth is most of us have maybe not such a exciting story than you. Why we are professional. Well, that's great. So you firsthand realized that, wait a minute, this guy's, he just helped me. This is good.
Yeah.
Something like that. Well, all right. Well, tell us about your purpose and goal for your practice a little bit. What type of dentist are you? What type of work do you want to do? Because different dentists have a different approach to things. None are wrong. That's just
no, that's perfectly understandable. My approach, to be honest with you, and I always tell this to people, it's a very interesting approach. When I look at a patient, I look at them as a person. So when I'm diagnosing, first of all, I want to talk to them. I don't go in and I just read out, my treatment plan and walk out of the room, and the person in front is going to work out the financials and thank you, I'm Dr. Garate, and my approach really is, when I'm looking at a person, is I'm looking at it as if it was my mouth. What treatment is needed that would go into my mouth? Sometimes, especially older people, I look at them as if it was my mom that I was treatment planning. And when I look at that, I always tell people that to me the most important thing is to make sure that they are able to keep all their teeth, and they're able to really kind of stop the damage that they're having. I find that in dentistry we focus too much on fixing things, but we focus too little on educating people. I would say that's the biggest thing that really drives me as a dentist, to really help someone. When I meet them, it's like I look at the history, and they always tell me, I've always had bad teeth, my family's always had bad teeth, and I always start talking to people, and it's really amazing to learn how much I learn from people, because most people don't realize that having bad teeth is not necessarily in the cards. It's always a little bit lack of information. So I'm always focusing on informing, on trying to educate patients, on treating them as a person, and how their mouth affects the rest of their overall health. And I think that's the approach that I've taken for quite a while, and it's an approach that makes it to where we don't look at a tooth as, oh, I'm going to lose this tooth, I'm going to fix this tooth, my life is solved. I look at it as, how is this all going to affect this person, and how today their life is happening, and how it's going to affect in their overall health in the long term. And most people don't realize that everything is connected.
All right. Well, wonderful. Absolutely. So basically, you know, look at it very holistic, but not only holistic from the viewpoint of the tooth and what can be done, but how does it fit that person? You know, if I would put that into another context, it's like, does everybody need and want $800 suit? Not necessarily. Quite often that $100 suit is just as fine, and this is what fits now. This is what gets that person and fits into his life with everything together, his work, his life, his health, and all that. And of course, it looks like prevention is the big thing for you, which obviously saves people a lot of money. Well, thank you, Dr. Garate. Thank you very much. Very wonderful. And of course, wish you all the very, very best and in your practice. And it looks like patients who come to see you, they kind of like hitting gold. They're lucky.
Thank you. Thank you. Thank you. I appreciate the good luck. Thank you.